Anterior nasal packing by ENT student. Among the nasal emergencies, epistaxis is one of the most common complaints that patients present to the emergency department with. Typically, epistaxis is a benign event that can be self-limited after the application of direct pressure. If the direct application of pressure for approximately 15 to 20 minutes fails, there are other methods that can be used. One of them is vasoconstrictive agents and silver nitrate cautery. But if this also fails, we go for anterior nasal packing. Now, there are two types of anterior nasal packing: packing in horizontal layers and packing in vertical layers. In horizontal layers, the first few centimeters of gauze are folded upon itself and inserted along the floor. And then the whole nasal cavity is packed tightly by layering the gauze from the floor towards the roof, from before backwards. Now, in the vertical layers, packing can also be done in this manner, where the gauze is packed from back to front. Now, what are the indications of nasal packaging? In emergency department, nasal packing for anterior epistaxis is indicated for bleeding that has not resolved even after the application of direct pressure, vasoconstrictive medications, and cautery. Other indications for anterior nasal packing includes surgical procedures, such as surgical procedures in ENT, or after oral maxillofacial surgery, or after minor surgical procedures. What are the contraindications? So the contraindications for anterior nasal packing is significant facial or nasal bone fractures, basilar skull fractures, or hemodynamic instability, or airway compromise requiring emergency blood transfusion or intubation. Now, once here the patient is stabilized, anterior nasal packing is permissible. What are the equipments needed? So the equipments needed for anterior nasal packing are a hospital bed that can be positioned to 90 degrees with a headlamp and an otoscope, suction canister with either wall suction or portable suction, Frazier suction tip and Yonkers suction tip, nasal speculum, bayonet forceps, tongue depressor, 4 into 4 inch gauze, 2 into 2 inch gauze, dental roll, sterile lubricant, antibiotic ointment, intranasal vasoconstrictor, topical anesthetic, nasal tampon or intranasal device, and personal protective equipment to protect the personnel. What are the complications of this procedure? The most common complications are pain. So there can be pain with insertion, pain with removal. Then there can be rebleeding with removal. There could be failure of hemostasis even after the packing, degradation or necrosis of the nasal mucosa, infection, particularly sinusitis, toxic shock syndrome, packing migration, and aspiration. Thank you.